Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
Uh, Epilepsy is one of the commonest, a very common neurological conditions from which many people suffer, and one of the conditions which is surrounded by a lot of stigma. So it's right time we discuss about the stigmas and how to get rid of it.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
So basically, the brain uses tiny electrical signals to control everything we think, feel, or do. The seizure happens when there is an overload of these electrical signals, and some researchers also describe it as a storm in the brain. During a seizure, many things can happen. Some people may lose consciousness, some can shake, convulse, become confused, shout, cry, or even feel a sudden sensation of impending doom or feel sudden fear or panic.
What is epilepsy?
So, uh, first thing is epilepsy and seizures are two different things. Okay, so seizure is a single episode, while epilepsy is a condition where a person has a tendency to have repeated seizures. So, if someone has had at least two unprecedented or unprovoked seizures, he can be said to have epilepsy. Or even if a person has one episode of seizure, but has been found to have a condition wherein he can have multiple episodes of seizures or repeated seizures, we can say that he's having epilepsy. So epilepsy can include many different type of seizures. Some people with epilepsies have one type of seizures, and other people can have multiple type of seizures.
What are the different types of seizures and do they affect people differently?
Yeah. So there are many type of seizures. Basically, two types, I would say. They depend on from what part of the brain the electrical activity starts and what part of the brain was covered by this electrical activity during its entirety. So there are generalized seizures and then there are focal seizures. So generalized seizures wherein the entire brain is involved, while the focal seizures wherein it starts from a specific part of the brain and stays there or is unable to engulf the entire brain in its activity.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
Not always. About half of the patients, in about half of the patients, we do not find any cause. They are called idiopathic seizures. But for the other half, common causes can include head injuries, brain infections, their sequelae, sometimes tumors. For elderly people, stroke can be a cause. Alzheimer's disease and other dementias, they can also be cause. And if we do not find any cause, in many cases there are genetic factors involved which can also be considered as a cause of epilepsy.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
So from epilepsy, what people normally gather is seizure is like when the whole body is trembling, there is a rolling of eyes, there is floating from the mouth, and there is a tongue bite. These are some of the common signs that people link with seizure or epilepsy. But it's not just that. Seizures can be of many different kinds. Some of the symptoms can be like a person having a blank stare, a short period of blank stare. There can be an abnormal shout, can be a feeling of impending doom, can be a feeling of something crouching or climbing up the stomach upwards, an abnormal smell, an abnormal vision. All these can be a symptom of epilepsy. So any of these kind of symptoms which happen for a short period of time subsides on its own and happens repeatedly. So that is the crux. If any of these things happen, or you see these things happening in people around you, you should contact a doctor.
Now let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
Yeah. Unfortunately, epilepsy has been misunderstood and stigma has been associated with it since time immemorial. Historically, people didn't realize that epilepsy is a neurological condition or a medical condition at all, and myths developed around it. Seizures can look frightening. People appear as if they have been possessed. So, obviously, a fear develops, and people try to avoid it and them.
How does this stigma affect people with epilepsy?
Regrettably, individuals with epilepsy often face negative attitudes and discrimination in their social life as well as their work life. Employers usually try to avoid people with epilepsy, and people with epilepsy they find it hard to get married. We see it on a day-to-day common practice that people with seizures or epilepsy hide it from their partners that they do have seizures. Many a time we have seen that young females they get married and when they have seizures, they say that okay they are having seizures for the first time. When in fact she was having seizures from the beginning, and after marriage she stopped taking medications and she had seizures. So these are some of the common stigmas that we face. Research has shown stigma can increase the frequency of seizures because stress is a common trigger for it. That's why the communities need to be educated and made aware of what it is, and that it is uh, not some act of ghost or God that has caused the
Absolutely. Now let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
triggers. Triggers vary
Yeah.
from person to person. People need to maintain a seizure diary in order to be aware of their own personal triggers. So, some of the common triggers are sleep deprivation or missing sleep, high stress levels, skipping meals, flashing lights, and fever or some other kind of illness, missing doses of seizure medications, and in females, hormonal changes during menstrual cycles can also be triggers for seizures. So maintaining a seizure diary helps.
That's a great tip, doctor. What other lifestyle adjustments can help someone manage epilepsy?
Several healthy habits can reduce the risk of seizures. I always encourage people to have a healthy sleeping habit because fatigue is a major trigger for many people. Eating regular, balanced meals and staying active can also help. Physical activity is generally safe and promoted in people with epilepsy, but avoid extreme or high risk sports without talking to a doctor. Managing stress is essential, and that could mean practicing mindfulness, relaxation techniques, meditation, pranayama, or joining support groups.
Thank you so much, doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
Yeah. Of course, at home, it's wise to clear things up. Keep things like cords, sharp objects, or hard objects which can harm the patient when if patient ever has seizures. Keep unbreakable or non-breakable dishes in the kitchen. Consider using microwave and staying alone. Also, place soft padded carpeting if it's possible, such that because it's very common for people with seizures to fall and break their limbs. These precautions are simple but can make a big difference in the health of an epileptic patient.
Thank you so much, doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
So, for all people with epilepsy and their near and dear ones, just remember with the right treatment, many people with epilepsy do live well and normal, fruitful lives. Being aware of triggers, avoiding them, practicing healthy living habits, having a good sleep hygiene makes a big difference. And remember, you are not alone suffering this ailment. There's a community to support you, and there's always a neurologist or some other doctor you can go to in case you have any doubts.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.